Have you ever wondered what the difference is between E. coli and Salmonella? Both are bacteria that can cause food poisoning, but they differ in how they can be contracted. E. coli, or Escherichia coli, generally lives harmlessly in your intestines and in the intestines of animals. However, certain strains can cause illness if they enter your body, typically through contaminated water or food, or from contact with infected animals or people. On the other hand, we have Salmonella, a group of bacteria that is a primary cause of foodborne illnesses. You can contract Salmonella from raw poultry, eggs, beef, and sometimes from unwashed fruits and vegetables. You can even get Salmonella from handling certain pets. Both can lead to unpleasant symptoms like vomiting and diarrhea. They can make you feel ill rather quickly. And while symptoms usually resolve within a week, prolonged symptoms require immediate medical attention. While both bacteria can cause foodborne illnesses, it's crucial to know which one you might have to address your symptoms properly. The symptoms of E. coli and Salmonella can be quite similar, as both are bacterial infections. However, there are subtle differences in the timing and range of symptoms that might clue you in to which bacteria is causing your discomfort. Let's begin with E. coli. If you've been exposed to this bacteria, symptoms typically show up 2 to 5 days later. However, it's worth noting that some people may carry the bacteria and spread it to others without experiencing any symptoms themselves. If symptoms do occur, they often include nausea or vomiting, severe abdominal cramps, watery or even bloody diarrhea, fatigue, and fever. Now let's shift gears to Salmonella. Symptoms of this bacterial infection can appear as early as 6 hours or as late as 6 days after exposure. The duration of symptoms usually spans 4 days to a week. Common symptoms include fever, diarrhea, abdominal cramps, and headaches. You might also experience nausea, vomiting, and loss of appetite. While there are similarities, the key differences between E. coli and Salmonella symptoms lie in the onset and duration. E. coli symptoms typically appear a few days after exposure and can last longer, while Salmonella symptoms can occur within hours and usually resolve within a week. However, regardless of whether it's E. coli or Salmonella causing your illness, there are certain severe symptoms that should prompt immediate medical attention. These include diarrhea accompanied by a fever of 102 degrees Fahrenheit or higher, diarrhea that persists for more than 3 days, bloody stools, prolonged vomiting, and signs of dehydration. Dehydration symptoms can include producing little to no urine, having a dry mouth and throat, and feeling dizzy when standing up. In conclusion, while E. coli and Salmonella share some common symptoms, the timing, duration, and specific symptoms can provide clues about which bacteria is causing your illness. However, it's important to remember that if you experience persistent or severe symptoms such as high fever, bloody stool, or signs of dehydration, seek immediate medical attention. So, how do you get infected with E. coli or Salmonella in the first place? E. coli is primarily acquired through the consumption of contaminated food or water. It's often found in undercooked beef or raw milk, but can also be present in fruits and vegetables irrigated with contaminated water. Person-to-person transmission is also possible, particularly in places with poor hygiene practices. Salmonella, on the other hand, is often linked to poultry, eggs, and raw milk. It can also lurk in pet reptiles or birds, as these animals are natural carriers of the bacteria. Cross-contamination in the kitchen is another common cause, where uncooked foods come into contact with surfaces or utensils used for raw meat. In both cases, these bacteria can cause illness if they enter your body, typically through the mouth. That's why it's so important to follow food safety guidelines like thoroughly cooking meat and washing fruits and vegetables. Understanding where these bacteria come from can help in prevention and early detection. If you suspect you've been infected with E. coli or Salmonella, it's important to get diagnosed promptly. Diagnosis typically involves a stool sample test to identify the presence of these bacteria. It's crucial to consult with a healthcare professional who can guide you on the necessary steps to take. Treatment for both E. coli and Salmonella infections primarily involves managing symptoms and preventing dehydration. This can involve drinking plenty of fluids or, in severe cases, hospitalization for intravenous fluid replacement. Some strains of E. coli can be treated with antibiotics, but it's not usually recommended for Salmonella as it can prolong the carrier state of the bacteria. In severe cases of E. coli, a type of kidney failure known as hemolytic uremic syndrome may occur, requiring hospitalization and potentially dialysis. Hence, it's crucial not to ignore severe symptoms or delay treatment. Remember, early detection and treatment can greatly improve your chances of a quick and full recovery.